Hi, I'm Dr. Rajani, and today we're looking at Sculptra injections to treat cellulite. Now, cellulite's a problem that has been around almost forever, and there's a lot in the literature dating back to hundreds of years ago to most recently. There's creams, topical lotions, potions, injectables. There's lasers and devices we can put down in to the skin invasively and break up the fibrous bands. It's a combination of likely hormones, fat pockets, fibrous bands, and genetics. And some people get it and some don't. There's maybe a genetic component to it seems, and it doesn't spare thin people versus fat people, because people with very little fat can have cellulite. So it's a big problem. And I want to take you now, we'll go to the video where we use Sculptra, and I'll explain more as we do it, but let's go now to the procedure and we can see it being carried out.
Frustrated with Sculptra because of clogging, but if you draw it up like this with the vial inverted, let it remain inverted while you're using it, then the product in there that creates the clogging will stay to the top, and you can draw the Sculptra with the PLLA beads at the bottom without getting the product that will clog it. So really, it's an art form. We mix it up 3 to 7 days prior as well.
Okay, so today we're going to use Sculptra, which is a wonderful collagen stimulator. And we're going to use it for a little different use today. We're using a special ChloraPrep skin prep, and we already prepped the skin, but we'll do one final prep here. And what we're going to do is stimulate collagen and break up fibrous bands. Now, I marked out some particular trouble areas here, and that helps us kind of identify, but the reality is collagen loss all around this area becomes a problem, and cellulite can be formed. Cellulite comes from many reasons. One is fibrous bands, and it's seen more commonly in females, of course, and it's been around since the beginning of time, but these fibrous bands pull down the tissue. It's likely estrogen or some hormonally mediated and genetic, and of course develops as we lose collagen. You get dimpling, and it becomes more problematic. And many women are troubled by this, and it's thought to be an unpleasing aesthetic look, at least at this point in society. So what I'm going to do is we'll stimulate collagen in these areas with particular attention to the areas I marked off. We're using a 22 gauge needle and Sculptra, of course. And I'm going to work back and forth to get some of these bands, but also get the product in there. Okay, so a little pinch here. Okay, so it does pinch a little bit, and I'm working back and forth. Okay. And I can feel the needle going through striated bands, okay? And just simply back and forth like this. And you can really coat the area if one wanted to, okay? And you can be more aggressive. Like here, I know from having the patient stand up and look at the area, I know that there's more banding. So what I'm going to do, a little poke here, I'm going to be a little more aggressive with, grab another needle here, with my back and forth movement, so that we get more of those bands and really break them up. Because remember, what we're doing is, a little poke here, I'll go through the same opening poke, breaking up those bands, stimulating collagen, and kind of releasing them. So it's really, we're getting two kind of mechanisms of action here. And one is, of course, mechanical, but how nice to infuse at the same point in time a collagen stimulator to thicken the dermal area. You don't get a lot of bruising, I'm a big fan of pressure after, and if patients don't bruise, of course they come back. In this area, we're used to injecting faces, and so bruising is an issue. In this area, of course, we have options because you can keep the area covered. So, but bruising isn't a big issue. And then, massage is important, and of course, a lot of the radio frequency devices, and one that we use, uses massage, lymphatic drainage, and the patient, just like on the face, will have some homework, 555, and that's massaging this product through. And so, of course, you get an immediate result from the swelling. I'm going to get another vial, and we're going to treat this area down here. I'm not going to really talk about concentrations here today, mainly because it's not really meant to be an instructional video, but that's something that is definitely very important in this area. Okay, so we got our other vial. I like to cleanse, and so especially where we put the needle in. And if you do injections long enough, you're going to have to at some point sort out a side effect of a nodule or a bump and determine, hey, is it biofilm, is it allergic reaction, is it a nodule, is it clumping? And knowing that you've cleansed the area and you can put that infectious cause lower on your differential diagnosis is really nice. So I know I want to come through this area and really treat this area. So a little pinch here. And this area, there was not a defined area that there was dimpling. So it's really, just in general, this area here is an important shelf to hold up the buttock. And laterally, it's really common to get stretch marks, to get dimpling. And you can see we're going back and forth. And unlike injecting, where you might be doing antegrade or retrograde, in this area, we might go back and forth without infusing products. So mentally, it's a little bit of a change from what we normally do. Normally I'd come in down below, but for the sake of film, a little pinch here. We're going to come in above, and you can see the depth of the needle here. So this is a really common area that people struggle with. And when do you see results? Well, it's interesting, and here we're not infusing, here I'm simply breaking up the bands. Because, and you saw that there, I don't know if you saw the needle flip, that was just a band, fibrous band, so let's spend some time there. So, when do you see results? Well, a lot of people get a bit frustrated because of course you see an immediate result, but it'll go away a little bit, and then it improves over time. And the patients typically do fine with that. They just need to be told that it takes a bit of time for that collagen stimulation. Okay? And so what I tell people is you get that immediate result, kind of goes away a little bit, and collagen builds up over the next several weeks to months. And remember that sure, breaking up the bands is going to help us, but you can see here just some dimpling, and it's literally loss of collagen in the skin, just like we lose it on the face, just like we lose it on the body, and the fat tends to come down to the love handles and lower abdomen, things fall. If the skin gets thin, even thin people will get an element of cellulite, dimpling. Peau d'orange, as the French call it. And so we'll also have the patient massage here. And you can see very little bleeding. We have our entry points here. And 555, similar on the body. And the patient will just get a wonderful result over the next few months and see decreased dimpling, tighter skin, even a little bit of lifting. So there you go. That's Sculptra in specific dilutions and injection technique to treat cellulite. So there's Sculptra for cellulite reduction. I hope that helps. Join us on YouTube or Facebook and like this video if you've enjoyed it below for further tips to keep your skin and body beautiful, healthy, and vibrant.